When you have a tooth that has been broken or damaged by decay, it can sometimes be fixed with a filling, root canal, or a crown. But sometimes there is too much damage for the tooth to be repaired and it must be removed. You may need to have a tooth extracted if you have tooth decay, advanced gum disease, a broken tooth that can't be repaired, or misalignment of your teeth. Before removing your tooth, we will perform a thorough clinical examination and review your medical history. We will develop the best and most efficient method for extracting the tooth, taking into consideration the tooth's relationship to other structures in the mouth, such as the sinuses, nerves, and adjacent teeth. We offer various forms of anesthesia to ensure that you are comfortable during your extraction, including local anesthesia, nitrous oxide, or IV sedation. During your consultation, we will also discuss options for replacing missing teeth, including bone grafting and placement of dental implants, which can often be placed at the same time the tooth is removed. We work hard to ensure that all of your surgical needs are met to maintain your oral health and restore your smile.